Hi everyone, you're welcome back to our discussion class. And today, like you see on the screen, we're going to be discussing on rational use of medicines, drug dependence, and substance abuse. This is a very strong topic when it comes to public health. All right. So we're still on public health pharmacology. And for those that doesn't know, my name is Jane Nnenna Ezikeanyi. I'm a master's student of the National Open University of Nigeria, and this is just a discussion on one of our courses, pharmacology, public health pharmacology. All right, so we just hold discussions to foster learning and understanding of the various courses. So let's dive in on this interesting topic for today. So let's first of all define some of the key words we are going to be seeing as we discuss this topic. Number one is, what is rational use of medicine? Rational use of medicine requires that patients receive medication appropriate to their clinical needs in doses that meet their requirements for an adequate period of time and at the lowest cost to them and their community. All right, so note the keywords. You receive the appropriate medication to the clinical needs in those that meet the requirements, and then for the adequate period of time and at the lowest cost as possible. That is the rational use of medicine. This is by WHO. Okay, so what's the irrational use of medicine? Like, irrational means inappropriate. That's the opposite of what rational means. So it involves improper, incorrect use of medicines. It is when one or more of these conditions or irrational use of medicines is not met. Okay, use of drugs that are not related to diagnosis or unnecessary, expensive, inappropriate use and irrational self-medications with many insufficient quantities consumption of drugs. So that's irrational use of medicine, just opposite of rational. All right. So what is a drug abuse? It's the persistence of sporadic excessive drug use inconsistent with or unrelated to acceptable medical practice. So it's an intense desire to obtain increasing amount of a particular substance. All right. So that's when you say you're abusing a drug because you're taking the drug in an inappropriate way. So we have hard drugs and soft drugs. Hard drugs are drugs that are generally considered to be more dangerous with a higher risk of dependence than soft drugs. So they lead to severe physical addiction. So a lot of hard drugs are what people get addicted to. For example, we have the heroin, metam, um, methamphetamine. Okay, so these are different examples of hard drugs. Then soft drugs do not cause physical addiction, just like the hard drugs. Why they do not cause physical addiction? Some of them may lead to psychological dependency. So this psychological dependency is a dependency of the mind. This means that people feel better when they have the drug. Just something of psychology. Okay, if I don't take this drug, I will not be well. All right. Example, we have the lysogenic acid, we have the cannabis, we have the diethylamide. So they are sort drugs. They don't cause physical addiction, but sometimes they can cause psychological dependency. They say a lot of people cannot do without that drugs. Okay, they just feel okay. They feel it's not like they cannot do without it, but they feel they can do without it. That is psychological effect. Okay, so whenever they take the drug, okay, they're okay. But if they don't, they feel that something. They just need to take these drugs. So we also have psychotropical substances. They are drugs that alter the central nervous system, such as sedatives, hypnotics, hallucinogens, and stimulants. They are majorly used as anesthesias in hospitals. Okay, they are called psychotropical substances. So the rational use of medicine, okay, we've defined it. And then unfortunately, more than 50% of all medicines are prescribed, dispensed, or sold inappropriately on a global basis. 50% of patients fail to take their medication correctly, according to estimate based on various ad hoc reviews. So these are just the research that was conducted, and notice that 50% of people use drugs, especially over-the-counter drugs, inappropriately. All right. A lot of drugs that people take these days, they are prescribed. or dispensed inappropriately to them, majorly not by doctors, majorly maybe by self-medication or all these over-the-counter medications. Then also 50% of people doesn't take their drug correctly. A lot of people, maybe when you are taking antibiotics and you feel you are now okay, you just dump the medicine. So these are really causing a great um, effects, especially when it comes to public health. All right. Common types of inappropriate medicine include polypharmacy, that is use of too many medicines per patient, overuse of injections, yeah, inappropriate use of antimicrobials, talking of antibiotics, right? Failure to prescribe in accordance with clinical guidelines, and inappropriate self-medication, often with prescription only medicines, all right? So this inappropriate self-medication can lead to inappropriate medicine. Roughly 450,000 people died as a result of drug use in 2015. This according to WHO. And out of these deaths, 167,000 were directly associated with drug use disorders. You can see majorly overdose. So a lot of people are actually using medicines inappropriately, overdose, use of drugs, self-medication. So drug-related disorders have been is a great threat to the whole public, all right? So examples of common inappropriate prescribing practices, the overuse of antibiotics and anti-diarrhea for non-specific childhood diarrhea, indiscriminate use of injections, multiple or over-prescription of drugs, wrong diagnosis, which can lead to wrong prescriptions, use of antibiotics for mild non-bacterial infection, example, common cold, tonics and multivitamins for malnutrition, unnecessary use of expensive antihypertensive, and adequacy of diagnostic process. These are common inappropriate prescribing practices. And when it comes to antibiotics, two-thirds of antibiotics are sold without prescription through unregulated private sectors, especially over-the-counter medications. Doctors prescribe antibiotics to patients who do not need them, while patients do not adhere to their treatments, causing the risk of antibiotic resistance. And overuse and misuse of antibiotics is a global threat. Yes. So if antibiotics have become ineffective, it means that these diseases or infections will lead to increased morbidity, healthcare use, and eventually premature mortality, which are mostly avoidable. But because the antibiotics have become ineffective due to resistance, it can lead to all these adverse effects. Okay, so we have examples of some of over-the-counter drugs. So over-the-counter drugs, they are medication that can be purchased without prescription, typically from pharmacies or drugstores. So they are designed to treat common or minor health issues and conditions. So these are some examples. You have like topical antibacterial or antifungal drugs like bacitrine, clotrimazole, miconazole. So a lot of drugs that we sold in a lot of pharmacy stores, they are over-the-counter drugs. So we have pain relief, smoking cessation, topical, all these topical drugs that apply on the skin, vitamins over-the-factor drugs, even cold or cough or allergy over-the-counter drugs like antihistamine, cetirizine, a lot of them. Okay, so so I have a notification from my phone. Okay. So these are different drugs, over-the-counter drugs, and a lot of them they are being abused or they are being used inappropriately. Okay, so there's some drug combinations that are not necessary. They are really unnecessary. Okay, and a lot of time you see a lot of physicians prescribing these drugs combinations, but they are not really necessary and they can cause they can lead to increased cost of medication and also add to the side effects of the therapy. Number one, we have ampicillin and clorazicillin. So ampicillin, they are antibiotics. The two, ampicillin and clorazicillin, they are antibiotics that fight against bacteria, right? But ampicillin is effective against gram-negative bacilli, but clorazicillin is an anti-staphylococcal penicillin and is not effective against gram-negative bacilli. So mixing the gram-negative and then the gram-positive, that is clorazicillin, anti-staphylococcal is gram-positive, okay? So the mixed gram negative and staphylococcal, which gram-positive infection. It rarely coexists. So in a patient with a single infection, one of the drugs of the combination will be useless. So in addition to the cost of the therapy, because when you go to purchase these drugs and you're buying these two together, it leads to increased cost, right? And in addition to increased cost, it also leads to adverse side effects and resistance of the bacteria to the drug. Okay, maybe you want to treat ampicillin, which is against gram-negative bacilli. Then you also add in clozaslin. So taking clozaslin, which does not even is not really affecting you, will lead to resistance of bacteria to the drugs because overuse of it will cause antibiotic resistance. So we also have antibacterial and anti-amoebic combination. For example, ciprofloxacin and metronidazole, or norfloxacin, antinidazole, or ofloxacin and onidazole. They are commonly available fixed dose drugs in combination. So in bacterial diarrhea, only antibacterial drug is effective, and anti-amoebic drug is useless. So similarly, in intestinal amoebiasis, only amoebic drugs is effective. So the amoebiasis and bacterial diarrhea, it rarely coexists. So there's no need in combining these antibacterial and anti-amoebic drugs, all right? We also have NSAID combination, that's a non-steroidal anti-inflammatory drugs, all right? Combinations, like for example, the nimesulide, the diclofenac, ibuprofen, paracetamol. They are some of the non-steroidal anti-inflammatory drugs, which is majorly used for pains. So there's no justification in combining one NSAID with another because there will be increased risk of nephrotoxicity with NSAID combination. That increase maybe liver problems or liver damages when you combine the two drugs because they are majorly doing the same thing, which is pain relief. So it's better to give one. Want to give paracetamol, you give paracetamol. Want to give diclofenac, not combining the two. All right. We also have codeine and NSAID. Some people take codeine and also take NSAID. This combination is used to treat severe pain or inhibit pain perception. But this combination can cause excessive sedation, which can be dangerous. Codeine is used for pains. NSAID is also used for pain, example paracetamol. So combining the two can lead to excessive sedation, which can be dangerous. So these are the common drug combinations that a lot of people do that are not really necessary. Because number one, they increase cost of medication and also add to the side effects of the therapy. Okay, let's go back to the obstacles or reasons why there is irrational drug use, or why there's use of continuous irrational use of drugs. Very few low and middle income countries regularly monitor drug use and implement effective nationwide interventions because of the following reasons. Number one is insufficient funds or personnel. Okay. We also have lack of objective information and of continuing education and training in pharmacology. We also have there is insufficient knowledge of concerning the cost effectiveness of interventions. So they lack awareness about the funds wasted through irrational use. We have a presence of large number of drugs in the market and the lucrative method of promotion of drugs. So because of the large number of drugs in the market, there will be irrational use of them. Lack of well-organized regulatory authority and supply of drugs. Then the prevalent belief that every illness has a pill is also causing an irrational use. Even some illnesses that just resolve on their own, a lot of people already believe that, oh, I need to take medicine to resolve this. It's causing an irrational use of drug. Okay. Then what are the impacts of inappropriate use of drugs? The impact is number one, reduced quality of therapy, ineffective and unsafe treatment, over-treatments of mild illnesses, inadequate treatments of serious illnesses, and exacerbation of or prolongation of illness leading to increased morbidity and mortality. So this reduced quality of drug can be a result of inappropriate use of drugs, especially when it comes to antibiotics. Waste of resources, reduced availability, and increased costs. Irrational use is wasteful and can be harmful for both the individual and the population. Risk of unwanted effects like adverse reactions and bacterial resistance. Psychosocial impacts, that is patients relying on unnecessary drugs, just like they believe that every illness has a pill. So adverse drug effects like is the commonest and the costliest consequence of inappropriate drug use of medicine. like food bleeding, cardiac arrhythmia, confusion, diarrhea. Like when you're using drugs when you're not supposed to use drug, all these are adverse drug events can actually occur. All right. So we have steps of rational drug use. How can one use drugs rationally? Number one, you have to identify if it's in a if you have a problem or you are battling with a key disease. These are the different steps you have to follow to use drug rationally. Step one is that identify the patient's problem based on symptoms and recognize the need for action. This is talking to clinicians or doctors, all right? Step two is your diagnosis of the disease. Yes, you have to diagnose because you cannot just prescribe drugs based on maybe the symptoms because a lot of illnesses have similar symptoms. Okay, diagnosis is very important. Then when after diagnosing, list of possible intervention or treatment. If that particular illness need drug or it doesn't need drug, you have to list the possible intervention that are required. Then step four is start the treatment by writing an accurate and complete prescription. Example, the names of drugs with dosage forms, dosage schedules, and then the total duration of the treatment is very, very important. Okay. Then step five is give proper information, instruction, and warning regarding the treatment given. Example, the side effects, the dosage schedule, or the danger or risk of stopping the therapy. So this is just like patient awareness. You have to tell the person what is involved in taking this drug. You have to give proper information to the people or to the person you are prescribing the drug for. Okay. Step four, you have to monitor the treatment to check if the particular treatment has resolved the patient's problem or if there's need to further check up. There are two different ways you can use a monitor. We have passive monitoring, which is done by the patient itself. So you have to explain to him or her what to do if the treatment is not effective, excuse me, or if too many side effects occurs, then you have to tell him or her to report back to you. Then we also have active monitoring, which is done by the physician. So you have to make an appointment to check the response of the treatment to the patient. So if you carry out these steps, you know that you're using you're rationally using drugs, okay, and not really abusing because by the time you've diagnosed, by the time you've checked the possible intervention, that means you are using the right drug at the right dosage and then the right amounts, okay? You have different strategies to improve the use of drugs, different strategies. We have educational strategies. There should be more awareness creation. That is to inform the public, to persuade the public. There's education, training of maybe the physicians, the pharmacists, a lot of training needs to be around media publicity. Okay, so the educational strategies, we have the managerial strategies to structure or guide decisions. This for maybe for the people that are in charge of all these drugs. There should be managerial strategies to guide decisions. Okay, we have economic strategies to offer incentives to providers. Okay, so this for the economic strategies. These are just the measures to use to know that people are purchasing the right drugs at the right amount. Okay, so you don't have to give maybe some pharmacy stores. They will tell all the sales personnel the higher drugs you sell, the more your incentives. So what do you think will happen? All those people they will start selling like prescribing more drugs to people so that the incentives will actually go up. So it's not a good strategy, all right? So rational use of drugs. We also have regulatory strategies where the goal is to restrict or limit decisions, okay? There should be regulations of all these drugs which should be put in place to improve rational use. All right. So I have this case report. It's actually from our material PHS 8110. So it said that a 20 years female student suffering from tonsillitis was seen by an OPD doctor in a 600-bed hospital. She obtained a drug from the hospital pharmacy and took it as instructed. So she felt very weak after taking the drug. Then 3 days later, she became severely comatose and was admitted to the same hospital. So she took chloropropamide, 250 milligrams, 4 times a day, as dispensed to her at the pharmacy. By the pharmacist, sorry. So the OPD doctor claimed that he prescribed chloromycetin, that is 250 milligrams, 4 times a day for her. for her tonsillitis. Then the patient eventually died 2 weeks after hospital admission. Discuss the possible cause of death. Identify any system failure. So I put it to you to actually answer this question. So I want you to just give it a try. Like before I move to the next slide, I want you to give it a try. Just drop it in the comment section. What do you think that? Why did this person, this lady, a 20-year female student, die from this particular disease? Okay, that is after 2 weeks of hospital admission, she died from this. So just read it again and tell me in the comments, why do you think she died? Just before, I want you to be very, very sincere. Before I will move to the next slide, I want you to see your answer in the comments, and I'm going to be seeing it. Let's discuss on why, what is the, like, is there any system failure? What is the possible cause of death? Why did she die? Okay. So just give it a try. Just give it a try. There's no harm in trying. It's actually helping you to your reasoning, your thinking. All right. So should I give you some time? Just pause the video and leave your comments. Okay. So let's discuss. So let's check on the case summary. We have a 20-year-old female student, and she's battling with, or she's suffering from tonsillitis. All right. Tonsillitis is an inflammation of the tonsils, which are two soft tissue masses at the back of the throat. It's often caused by bacterial infections. These are some of the symptoms: sore throat, swollen tonsils, and then difficult swallowing. And then the intended prescription by the doctor was chloramphenicol, which is chloromycetin, at 250 milligram times 4, that is 4 times daily. But the drug that the pharmacist gave her was chloropropamide at 250 milligram, that is 4 times daily. So this chloropropamide is a sulfonylurea used to treat type 2 diabetes mellitus by increasing the insulin secretion. Okay. So what is the probable cause of death? Is like is severe hyperglycemia caused by chloropropamide, an anti-diabetic drug, in a non-diabetic patient. This lady is non-diabetic. She's only battling with tonsillitis, which is a bacterial infection. And then the doctor prescribed chloramphenicol, that is chloramycetin, but the pharmacist gave her chloropropamide, which is an anti-diabetic medicine. So probable cause of death is hypoglycemia, which resulted in neuroglycopenia and then coma and death. Do you understand? Just like a non-diabetic patient taking a diabetic drugs. So there will be adverse effects, which is neuroglycopenia, and then neuroglycopenia, and then coma, and then actually lead to death. So what are the system failures? Number one is look-alike or sound-alike drug error, which is LASA drug error. This chloromycetin and chloropropamide, it depends on how um the doctor actually writes drug. So chloromycetin and chloropropamide, these are the possible system failures. All right. So look-alike or sound-alike drug error. Number two is the pharmacist dispensing error, which is the major the major cost here, because it's the pharmacist pays to verify the drug against the diagnosis, that is tonsillitis. Because assuming he or she read, okay, this lady is battling with tonsillitis, why is the doctor, even though the doctor made a mistake, why is the doctor prescribing chloropropamide, or why should I dispense chloropropamide? All right, so there's a failed pharmacist dispensing error, and also lack of communication. There's no coordination between the prescribing doctor and then the pharmacist. There no patient counseling. The patient was not informed about the medication or the possible side effects. Because assuming we discussed about maybe informing patients about possible drug effects. Assuming she was informed that, okay, if you take this drug and you see this reaction, please report back to the hospital. I think she would have reported in the hospital. And also, there's no double check system. There's absence of safety checks in prescribing and dispensing process. Assuming there's a second person to actually double check this prescription, this could have been also mitigated. All right. And there could because the doctor, the reason why I'm not putting the blame on the doctor, because he actually said he prescribed this chloromycetin, all right? So there could be an error this error is now from the pharmacist, okay? And also lack of communication between the doctor and the pharmacist. So do you understand where I'm going to? And do you understand the whole explanation? So let me know what you actually thought. I'll check the comment section if you actually get it, okay? So that is it about the um all right. So I think that is it about this topic discussion, all right, on pharmacovigilance. Sorry. Sorry. So our next discussion is going to be on drug dependence and substance abuse. Drug dependence and substance abuse. So we previously discussed on rational use of drugs. Okay. So don't mind me. I was mentioning pharmacovigilance because that's just the topic we just treated. I just finished treating it, so it's still in my mouth. Okay, so we'll be discussing drug dependence and substance abuse, like you know, on the screen. If you are yet to subscribe, please do so. All right, because it's going to let you um know when I post another discussion, okay? And also way of growing the channel. And also you have to like and share this video to anybody that you know that he or she will benefit. It's very important. Please share. Please share to anyways. It's good to disseminate because also you teaching people on what you should be doing because I think this is value packed. This is value packed because before I actually know about all these, I don't know that there's a way that someone can actually report adverse drug reaction. I don't know that there's a form that you can fill in the NAFDAC website. So a lot of is value packed. So you can share with someone just for educational purpose. You can share with someone, maybe someone that is writing exam, this H110 exams, can share with him or her on the group. All right, so it's free. Thank you so much. So let's dive in. So drug dependence and substance use disorder. Drug dependence is the body's physical need or addiction to a specific agent, just like drug, over the oh, okay, over the long term. The dependence results in physical harm and behavior problems, which causes tolerance and cross tolerance. So it's just like someone gaining addiction to a particular drugs. Okay. So drug abuse is an intense desire to obtain increasing amounts of particular drugs. The public health professionals have attempted to look at substance use from a broader perspective than the individual, emphasizing the role of the society, culture, and availability. So some health professionals choose to avoid the term alcohol or drug abuse in favor of the language. They consider more objectives such as substance or alcohol type problems or harmful or problematic use of drugs. So a lot of time a lot of health professionals don't like to use drug abuse because they feel is more offensive. So you use substance abuse or substance use or alcohol type problems. So these are just another ways that can use. So substance use disorder, which is formally known as drug addiction, is a problematic pattern of substance use that affects one's health and well-being. There are different causes of substance use disorder. The cause of this SUD is still unknown, though genetics thought to account for the 60% to 40% of a person's risk. So substance use often starts as a way to feel good or out of curiosity in childhood or in adolescence. And then repeated use of this substance and increased tolerance pave the way to substance use disorder and addiction. So let's look at the different risk factors that may lead one to if it should be okay, different risk factors that may lead to a substance use disorder. Number one is family history of addiction. We talk of genetics, which accounts for like 60% of it. So drug addiction is more common in some families, and it likely involves genetic predisposition to mental health disorder. All right. We also have peer pressure. Peer pressure is one of the most common, especially among youth, teenagers. They start to use drugs because they want to fit in, being rebellious as a teenager or young adults. If you're not if you're not doing drugs, you're not among the happening people in the society. But it's a lot of peer pressure. It's not like a lot of people want to do it, but they just want to belong. Sleep problems and chronic pain. In many cases, substance like alcohol or marijuana and prescription painkillers act as a gateway to drugs that have a more intense and mind-altering effect. We also have experimenting. A lot of people like mind experimenting sometimes like cocaine, alcohol promise to heighten experience, and that experience is worth exploring. So, unfortunately, these are drugs like heroin, ecstasy, and meth that are so addictive that the person will begin a pattern of abuse, which eventually leads to an addiction. Right? So these are just the difference. Um, Okay, so these are the addictive that the person will begin a pattern of the abuse, which can eventually lead to an addiction. We also have self-medications, which is one of the top reasons people abuse drugs and alcohol, like stress, someone has an anxiety, recurring pain, like a lot of things can make you want to be taking drugs every time. And other factors like financial difficulties, maybe someone that have relationship problems or loss of a loved one, hence home, lack of parental attachment in childhood, relationship issues, just like I mentioned, and long-term tobacco habits can actually lead to substance use disorder. Just note that none of these risk factors guarantee that a person will develop a substance abuse disorder, but a combination of factors plus repeated substance use, okay, significantly increases the likelihood of what? Addiction. Okay, so let's look at the classification of drug dependence or substance use. We have the CNS stimulants, which is central nervous system stimulants. We have the CNS depressants. We also have cannabinoids, we have opioids, we have the hallucinogens. So I try to make a brief explanation on each, but if you want a more profound explanation, you can check the material, okay? For this central nervous system stimulants, they increase the brain activity, alertness, heart rate, energy, leading to euphoria, that is happiness, restlessness, insomnia, anxiety. So they have a high potential for psychological dependence, and also long-term use may lead to paranoia, aggression, or psychosis. Okay, example, we have cocaine, vitamins, methamphetamines, and also caffeine. They have the ability to stimulate the brain. Okay, they also have central nervous system depressants, so they slow down brain activity. They are just opposite of the CNS stimulants. So they causes relaxation and sedation. They're majorly used to treat anxiety, insomnia, which is lack of sleep, seizures. So they can also cause drowsiness, confusion, respiratory depression. All right. Example, we have diazepines, such as diazepines. So, sorry, diazepam. Also have barbiturates. We also have alcohol. A lot of people take alcohol, maybe they're just having anxiety or they just want to relax. Hey, this is the correct way they normally use. Want to relax my brain. Okay, so that's the CNS depressants, all right? So we also have cannabinoids, the alter mood, perception, coordination, causes euphoria, relaxation, altered sense of time. They may impair short-term memory and judgment. Long-term use is being linked to psychosis. When you tell that someone is having psycho, this person gets psycho. Example is marijuana, also the hashish. So we also have the opioids, which are strong pain relief and intense euphoria because there are high risk of both physical and psychological dependence. Withdrawal symptoms can be pain, diarrhea, anxiety. The major risk of overdose and respiratory failure. Example is heroin, morphine, codeine, tramadol, okay, fentanyl. Then we have the hallucinogens, alter perception, mood, and thought. Users may experience hallucinations and alter reality. That's when somebody that's taking hallucinogens may see a human being and think it's a chicken and just shoot you or kick you. So it's not physically addictive, but psychological dependence is possible. It can trigger long-term psychiatric problems like psychosis. The examples are lysogenic acid, diethylamide, and amphetamines. So all these are just drug dependence. They are very big and there's a diverse discussion on it. Okay, so you can make more research about them. to know more on how they actually stimulate, that is for the CNS, for the stimulants, or how they depress the brain and cause relaxation, that is for the CNS depressants. All right, so you can know more about it, but it's just a brief explanation of what they do to the body. So we have the management of substance abuse or dependence. How do you, maybe someone that is already addicted to all these drugs, how do you tend to manage them? So the two major goals is number one is abstinence from the substance. You want the person to avoid the substance well. And then the second one is physical, psychiatric, and psychosocial well-being of the patient. Because a lot of them, when they have abused this drug for a long time, it can lead to even psychosis. Like you see, I've mentioned psychosis in the long term. Yeah, so the pharmacological treatment of this substance abuse is that because this substance abuse or dependence is a part of neuropharmacological phenomenon, there's at present an aggressive search for agents that may decrease the reinforcing properties of substances, that is, block the drug euphoric aspect. That's for those that may want to have this euphoria or overexcitement. So there's this research to provide drug that we actually block that effect, decreasing craving associated with substances or functions as replacements for the drug abuse. For example, we have the naltrexone, which is an opiate receptor blocking agent, like from the opioids. They decreases alcohol consumption and relapse in alcoholic patients, also in opiate abuse. So we also have the nicotine replacements using nicotine gum, patchy or spray and inhalation have been used with successful results in nicotine dependence. We also have methadone, which is an opiate receptor agonist, proved to be effective in abstinence from opiate use. So throughout the course of the treatments, also the person in particular has a big role to play because you have to make up your mind that you want to stop the abuse of drugs even before all these treatments. Okay. Also, family therapies can be very, very effective. Okay. So these are just the management of system abuse or dependence. All right. I hope by this time, so we've been able to. Okay, this is meant to be a self-assessment exercise. Okay, so we have can list some examples of over-the-counter drugs, outline the adverse impacts of inappropriate drug use, discuss strategies and interventions to promote rational use of medicines in Nigeria, list the five most common substance abuse, mention ways substance use disorder can be managed. All right, so this is just like a self-assessment exercise. You should checkmate yourself. Okay, so at this point, I want to say a very big thank you for those that stay through our discussion class. And if you have any question, please leave it in the comments and we'll discuss it. Remember, it's discussion we are doing. Oh, I'm not your lecturer. I'm not your lecturer. I'm a student. All right. I'll see you in the next video. Please don't forget to subscribe and share to your faves. Thank you so much for your attention. Bye.